Someone you know is sick or tried to get help and is not feeling any better? Then call or visit the Health and Wellness Center, where we will screen your entire body and find your problem and treat you so that your body will overcome your illness. So visit us today, 72 Queen Street, Kitty, or call us at 231-6477 for further information.
Okay, a very good evening to all of you, my friends, family members, well wishers, and all of our viewers. Welcome to our program once again. And it seems like days are just rushing by. Dr. Richard, it seems as though we were just on here a couple of years ago. 2 weeks ago since you were on.
That's right.
Yeah. Well, if you notice, the screen is very full of faces. Maybe one of the two new faces may look familiar to you. That is Dr. Joseph to my right, and then to right, we have Stalin. To my Richard. And of course, you're truly myself. Whenever I'm on, you see me. So we've been doing this program now since 1996. And it's been very successful. I mean, thousands of people we don't even know. They would call us and tell us they followed our program and followed something that we recommended, and they feel better, or they got better, or they come in to visit. And but this group of faces that are all physicians who are here, maybe guide you along a path of some sort. Okay, Dr. Richard is in Atlanta, and Joseph and Dr. Connecticut. That's right. In Connecticut. But today, they came for a very short peep, and to go back. Unfortunately, we were trying to cut a deal with them. But there's not enough time to negotiate the deal, Dr. Richard.
Wow.
Dr. Stalin is a dermatologist. So if you have any questions about your skin or your hair or external parts, probably assist you today. She will talk about whatever she wants to talk about. This is a conversation we're going to have. Dr. Joseph Jr., we don't want him to do anything because cut you up. He don't want that to have any attention. But they both are here visiting. Dr. Stalin is not Guyanese by birth.
Like I'm a Guyanese.
Food and all of that.
How's she doing?
Well, she's
Good.
coming along. She wants to have real down-to-earth Chinese.
Oh,
We had some good.
You had some?
We tried some yesterday.
Oh, you tried some
Tried
yesterday?
one of
It's
the
good.
new tridents.
Oh, you had some. So you got your wishes.
The wishes came true.
The only one she hasn't. She wants to go. It took water, but she was kind of.
oh,
tired.
she want to go in the water.
Yeah, you know. Or,
Oh boy, I hope you ain't got no allergies.
Well, found out.
Oh, you went in the
She knows what to do anyway, so we took her by the at Lynn.
Nice.
Yeah, but apparently that was too big for her. She didn't want to dance.
I wanted more time. Just a hot, quick jump in the river was not going to be enough. So I was like, another time.
I wouldn't jump.
Well, one of our viewers just mentioned studio internet is slow and it's breaking up very bad.
Oh,
So they probably need to turn off a few of their other apparatuses that are on. We just kind of gaffing a little bit. It's Cancer Awareness Month midway. We've talked, and we never really got back into finishing our discussion. But today is going to be open because we have these.
oh, you get a lot of there. There's a lot of information.
On this screen today. On the screen today, we have a lot of knowledge. And between the four of us, we could probably handle any case, right? You think?
Oh, yeah.
Experience between us all.
50?
Yeah.
More.
More, probably
Probably more. I was again.
It's more.
Yeah.
I finished in 92.
To making us younger. So that's
Yeah, that's good. That's good. Dr. Richard finished a long time ago. He finished before me, I think.
Oh,
yeah.
Of course.
I'll take the young. Yeah, you're right.
50 years of experience, it's a lot of years. There are people who don't even live that long.
Yeah.
You know, there are people who die very young and they, you know, whether otherwise or accidents or, you know, suicide. A little while ago, the implications of suicide. But I want to open the line to have Dr. Starling.
Yeah.
Just we have lots of viewers. This is a live program anyway, by the way. It's a live TV program. It's in households, right? We designed it to be household, you know, in Guyana. It's mostly in Guyana, but different parts of Guyana. We are online, so, you know, we're building our online viewership slowly online because I'm getting communication in people's homes. So could you kindly please yourself to the guests that are looking?
well, hello everyone. Starling Haynes again from the Midwest area. I went to undergrad and medical school at Ohio State, and now I'm working in Connecticut as a dermatologist. And dermatologist, so it's been a lot of fun seeing patients on my own, taking care of my own patients, and still continuing to learn as I go forward. So
Thank you.
Dr. Joseph Haynes, just call me Joseph Haynes Jr. I'm a neurosurgery resident at Yale, third year. Originally from London, yeah. Well, here in Guyana, primary school. Had a brief stint at here in town.
Green Acres.
Yeah. Then high school, I did in Bar. Like undergrad in New York, medical school in New York, and then now neurosurgery resident at Yale. I mean, I set up. It feels like it was, you know, the years themselves. You know, the years go every days, especially now. You know, when I was growing up in Guyana, there were 0 neurosurgeons. I know we didn't have a neurosurgeon here until 2015, Dr. Dookie is doing his thing. Here. But that was it was a big pull for me to go into neurosurgery. Not only, first of all, medicine, because obviously dad's in medicine, a lot of our family members in medicine, moms and whatnot. But obviously, lack of this field, I think I am. So that was a big reason for the pull for me to go into neurosurgery. I took that path. All that. I'm practicing on my own yet, but learning every day. And a foundation here, and I encourage anyone of the viewers has a dream of becoming anything, but anything in medicine. For everybody in medicine, so many different fields, so many different facets of medicine. Anyone who's either interested or might be interested, I encourage you to.
Thank you, Dr. Joe. I'm trying to respond back to the folks who would all the time that I was listening. Dr. Joe was on this many years ago. I think it was Channel 9. Yeah, he was just in medical, right?
Just starting, I think.
Just starting many years ago. And it's amazing to see that what you just said, if you really any to stay achieve it. And I'm proud of him and proud of Starlin. Young people, just young, you can see the baby on his face still. With Starlin, same thing. They still have baby faces. See them stay focused and progress to the point where they're it's really Richard, you also have in your children, got a couple of doctors in there. And I was saying that if we were our children and we can actually do a hospital.
Yeah, I mean, I had a professor in medical school, the same situation in his family. Were doctors.
Wow.
He was a gynecologist and did gynecology too. So after they were finished, he went to the hospital. And that is Dr. Baton. You can look it up on the internet, and all of his kids. I mean, they're doctors of them, and that's very possible. Well, who knows? Who knows the limits? Who knows the possibilities?
Maybe someone say the same thing about us.
Yeah.
If you can, or your travels and we our little ones to merge into the process.
Yeah, the process is different now. It costs too much to maintain a lot of practices. Most doctors now they're giving up their practice because of the a whole lot of other issues. I don't know. I mean,
we all worth it, right?
These guys, they would know. They deal with hospitals every day almost. And they would want to be owning something like that, and
That's a lot to think about.
yeah.
Yeah, it's a lot of responsibility.
Yeah.
It's a lot of responsibility, and it's not easy to maintain. though many years ago I was granted the permission to do one, and then it probably still stands. You know, I had everything done. I was given at Linden, so I don't know. Anyhow, welcome to the program. And on Thursdays, for the most part, we would discuss all topics, and then we'd get phone calls. I don't think we take any calls today, but we're not in studio. Maybe it can be worked out somehow. But in your work, Dr. that you would have encountered during a period of time with persons with dermatology type of problems, be it psoriasis or pimples on their faces or
Everything.
so. What kind of advice would you give them? Looking at your
Okay, so acne. You know, I think I was blessed on the genetic side because the people in my family don't really have a lot of acne. Sometimes you can't get away from it if you have a lot of acne in your family. But a lot of things that I'm not sure what we have here in Guyana. First thing, you can come see Dr. Haynes to get an assessment. Do that. There's a lot of different topical medications that you can use. Benzoyl peroxide, acid. Those are things that are over the counter that you can use if you have more acne. And then using things like differin gel as a retinoid that actually helps with the formation of the skin cells, and it helps make them go fast and the bad ones to come faster. That's a really good one that we can use that's really get as well. But then sometimes you also have severe, moderate to severe acne and acne because acne can be due to the and other types of systemic agents like Accutane, which is that we use a lot in the States as well. But it's one of the funnest things to treat for me, honestly, because the topical medication, as long as they are consistent and actually doing their regimens on a daily basis, and time. It usually takes about 3 before we can. It just takes a long time for acne to get better. And as for folks in Guyana, folks with skin of color, hyper things that for that really is maintaining your sun avoidance with using things like sunscreen. And a lot of the times we don't really that we need to use sunscreen, especially as people of color. Most of the time you hear that you just need to wear sunscreen to try to reduce your risk of getting cancer. But it actually helps a lot, mainly, which is as well as with the hyperpigmentation that from. Those are a lot of different things that you can potentially look at over the counter. Hopefully they in Guyana. I haven't been to one of the pharmacies here, but it's really easy to get usually. And then, you know, as well, like high glycemic foods, which means that it's things that are high in sugar. Carbohydrates might affect certain people a lot more than others. Things like whey protein, that can be a big one. And hormones as well, especially for our hormones play a huge part in what we have. It can lead to worse acne, especially in the jaw area. So sometimes we need to use anti-hormonal medications, both topical and oral, we can do to help with that aspect of the acne. But it's one of the most rewarding because people really are serious, you know. It's the thing that the people see when they see you. And you know, if your face is not, if you're not comfortable with your face, or if you feel very self-conscious about your face, that ability to move throughout life in a way that helps you get the job. Like it's really huge. So being able to see can get people really with a lot of these medications. So it helps people a lot.
Do you employ any dietary advice or changes or anything?
I do. Earlier, those glycemic changes. It really depends on a lot of people don't activity to foods. So unless they feel as though it gets worse after eating type of food and they eliminate it and it's better, I might not say much of it, but if they do tell me that, if they give, okay, yeah, there is evidence types of foods that can potentially lead to worse or acne for you, so it might be something to avoid. And I give the handout to all my patients that things to hear if your acne is not getting better with the regimen that we gave them.
There's since we talking about face and there's what they call that.
Yeah, so Rick Doan has.
Yeah, where we see have
Yeah, that's super common. I think it's probably even more common in the US than here because for some reason this beautiful air that you guys have here get away for some people. With dandruff, a yeast infection that everybody pretty much has, but because of the oil production that your skin has, people might get it in others. And with that, a lot of different things that we can do. And most of the time it's on the scalp, but some people have it on their face and on their chest and even sometimes in their private areas too. But which is the anti-dandruff, anti-yeast medication is one of the number one. Using it and leaving your skin for about 5 shower, X, Y, and Z, and then rinsing it off pretty much gets people under control. But the thing about it is that a lot of the time people don't have conditions, so it's something that can come back. So they start using the medications and then it comes back to happen. So after it gets better, we advise people to do a maybe 1 to 2 times a week to keep things under control. And then sometimes that doesn't work, and so selenium salt, I think that which kind of helps with flaking and things like that. And then it's really interesting that there's a lot of new other types of medications that are coming out in the States right now, things like roflumilast or Tiama, things like that really some of this stuff. There's a lot of things there that you can use, and it just depends on what works best for you. To alternate between to use as well. Because you can get, sometimes the yeast gets, so you might want to alter different type of shampoo as well. It's very frustrating. It's very hard.
Yeah.
Sometimes we have to antifungals to get under control, which is tough, but
a very popular shampoo they use is Head and Shoulder. I think it's and there's another one, the type of shampoo that's low.
Yeah, the higher pressure, but that stuff over the counter does work too. Depending on how bad it is.
Tell us about you. Yeah, well, what counter? I mean, what you're doing? Young boy, grew up in England, and then he migrated to his grandfather, come from in Barbados, and now he's doing a lot.
Like you started off by saying, hopefully, people out there will not have a need for going through is that, in a country like this, there will always be a need in a variety of ways, whether it be in the day people still have neurological, neurosurgical, everywhere, right? Whether you're talking about cancers or which would be a very common factor. I mean, I guess things that my perspective would, don't ignore your body if it's telling you something. Times, in fact, oftentimes neurosurgical diseases per se, but an obvious one, if you're not a person that gets headaches, I mean, headaches could be from anything, right? And most of the time, if you find yourself getting a headache that's not the norm, right? It's probably not a neurological problem. That said, don't ignore it. Make it up when you see your doctor. Go to your visits regularly. There are a lot of neurosurgical problems that lifestyle. So I'm very interested in stroke and cerebrovascular disease, and will that's actually the area I went into. So I'll actually fellowship. And I'm sure that there have probably been a lot of discussions on here to people having various diseases that will contribute to stroke and or point, maybe even needing neurosurgical intervention, either by way of some sort of opening up the neck. That's a or to me or surgery related to stroke.
That happened here is that we consume an enormous amount of fats, a lot of fat. Everything is fried. Fried plantain, calorie fried, there's a lot of oil. That's oil. So we encounter here many persons with arteriosclerosis common. And every day almost when we screen people, we find there's an enormous amount of plaque built up in the arteries. And the headaches, you talk about the headaches, they're suffering with the headaches, and then some of them are having problems with their vision, and then some of them have already had stroke and through the crisis of that. So I'm quite sure as you go in, you probably do notice in instances that you would have encountered, but here, we see it all the time. When we screen people, and Dr. Richard is shaking his head.
But yeah,
probably hasn't seen as much as he's.
Well, I'm very, very honored and impressive to see those, because I know when I was in medical school and you're looking to go to residency, they tell you the first thing they tell you is if you think about going for a dump or a neuro, you go for surgery residency, you have to be the top students. Residency to get. If you're a top student, be the top of the top. So it's an honor, and it's there what we're seeing right there. As a neurosurgeon, those are two difficult residencies to get. Yes. Yeah.
Yeah, it's number 1 and number 2. I won't say which one it is.
Wow.
So to have lot of information, a lot of knowledge. They're very knowledgeable. Has to be.
So what can we do to get them here?
Show
Show me the money.
Didn't say
Show me
that.
the money. Yeah.
Yeah, I know. For the dermatology, I know there's certain like leprosy in that.
Oh, yeah.
I have not seen leprosy, but
Uh,
myself, like as an it's come in, but seen them.
yeah, I'm pretty sure that a lot of cases in Guyana. They
Yeah.
can use your help. I'm
Actually had, in fact, I have a very good recollection of a very recent case. And as a matter of fact, someone sent me a note that says, we talk about osteoporosis and
Yeah.
Kentucky Fried Chicken, a lot of fat. But getting back to that, there was a gentleman that came here. We had a girl. When it was hot and he was, I'm wondering, when I saw him, I said, what is it that why are you so covered? What's going on? And he looked up at me, his face, and I knew that there was something deeper. When he opened up his cover, I mean, it froze.
Yeah.
And what I saw, and he says, Doc, I'm ashamed to even walk in the road, even in my house. I'm ashamed to take off my clothes in my house. And I said, well, what diagnosed you with? And he put his head down, I said, no, lift up your head, right place. What did they diagnose you with? And I knew, but I wanted to hear from him. He told me I have leprosy. And they can't do anything for me with this, but, I have no other place to go. I'm telling you, it took us the guy was very persistent every month. And when he first came here, we had to do things to clean up the place after he left. It's Dr. Richard. Doctor, this guy, I believe it was the same guy. 6 months we cleaned him up.
wow.
And, yeah, and he's out there working, and we got to the root cause of his condition, and did a lot of bioresonance on him. We did a lot of internal medicines on him, a lot of the globes, and cleaned him up nicely, detoxified him like for 2 months straight. And today he's living normal, like happened to him before. You can see traces because he had it really bad. Yeah, you can overcome leprosy too. Discipline here, and Dr. Richard would have experienced some of it himself.
Yeah, but not that one. That one is that
was a serious one. Then we had a girl,
interesting.
a little girl. She came in they put her out to school. She couldn't go to school. And because of his case, I knew exactly what to do with her. Yeah. So you become leprosy. People who come here that couldn't even walk when they came here. Seriously. They would come between two people, with their arms around them, and we get them back on their feet again, walking, got them healthy and happy, and they're like ambassadors going out there telling people. The worst case we had here was a case that was sitting outside in a chair outside the clinic. I take break and come back in here. And I saw this guy in the chair and he had his head back, And him, when I looked at him, And I knew he wasn't sleeping. So he said, "Who brought this guy here?" You know, and the young lady says, "Well, we just brought him a little while ago, and we noticed that the clinic is full, so we just had to sit him here." So he said, "Are you sure you brought him 3 minutes ago?" He said, the car, anything. I came in up my some they brought the guy here that was dead.
That is insane.
What?
He was sitting outside. We didn't even, we never, Joy never even, or Fiona was here. Never had a chance to even go to do his vitals.
That's insane.
The worst he had was that. He was dead, he was sitting out there dead. The police had to come, and it was a chaos here. He was out there. I went out just for a walk to see what was happening out there. And they brought him, and then they lifted him out of the car. Said to me, "Don't wonder he was so heavy when I picked him up out of the car."
Well,
I mean, it's not funny, right? But I mean, they actually brought somebody that was dead.
Not a cure for death yet.
No, but you know what? I wish I could. You see some people and you just wish that you could do something to get that life back into. I think it could happen. You know.
Never know.
Jesus did that.
Yeah.
And I whatever he did, I'd like to know what he did. Because there's some people who I wish that they didn't die, you know. Yeah, I'm not sure we have to work on that.
yeah,
It's
I'm
gotta
working,
be something. You know,
I'm working on my own. Yeah, my help in the Lord, man. I guess that's. But it's Joe. What sort of cases you're dealing with right now? Neurosurgery.
Wide breadth. So, we were in stroke, and from that perspective, just that chapter. Actually, I was just on the phone with one of my mentors at Yale, but had to get off the phone because he was about to do a thrombectomy. A lot of these patients coming with a stroke, but they're within a time frame, in the States and whatnot. We'll do all the imaging and whatnot. And time frame, and on the scan, you see that there's brain tissue that's dying, not dead yet, right? And then you see that there's a blockage in one of the main brain, and all the criteria. Then you can do you very, very fine little tube up through the the groin, and then it's very crude, but you basically either suck out the clot, or you try to grab it with we call it a stent retriever, a little cage, and pull it out. It's all very blood vessels.
Wow.
So there's that. And since we're on the topic of stroke, after the thrombectomy, sometimes people have a stroke. Either you do the thrombectomy or you don't, and then dead swells, right? Sometimes people get so much swelling from the stroke that you have pressure on the rest of the brain because the skull doesn't swell.
Doesn't expand.
Sometimes you have to do certain to decompress that pressure, craniectomies and what have you. And then if you talk about me, we've seen a lot of them where perhaps someone took a fall, elderly person took a fall, and there's a lot of blood in the head, and you need to do sometimes if it's not blood that's too fresh or too new, it's very thick, then you or other times if it's it's very new blood, you might have to do a craniotomy, get that blood out. Right, for a variety of reasons, people have very large fluid-filled spaces in the brain. Sometimes they become symptomatic from it. So we'll do a lot of shunting, meaning you long story short, you'll actually place very fine tube, almost like a straw, into the middle of the brain, and then you run another tubing down into the skin, either into the heart or into the abdomen. And then you can pull it off, because if your brain, sometimes people can get all kinds of symptoms to the point of even dying. Speaking of that, as a air resident, leaving acute hydrocephalus is one of the first sort of procedures you learn. That's bedside, actually, where, let's say, someone has in the brain, variety of reasons, people could also become hydrocephalic, meaning up in the brain. Think about it as with all that blood, it's very deep. So your like filtration systems in the brain, they're all like clogged up. And so bedside, first procedure, one of the first procedures you learn bedside is, right, through the skull, past the tube, blinding into the middle of the brain to relieve that pressure. Of course, once you have them stabilized, before you can move on with the rest of the management of that patient, which is very, very complex, managing patients who have ruptured aneurysms. Either doing surgery, surgery to take them out of the brain, or surgery with radiosurgery. So we'll actually be very involved with radiation therapy to the brain in a form of radiation, which is unlike your conventional radiotherapy. It's very precise, very radiation. Radiation. You can use that to like tumors, and vascular lesions like AVMs and whatnot. Then spine, neurosurgery is also spine surgery, the whole gamut, spine, been involved in all those kinds of cases, spinal deformities, people who have slipped disc, right, and stenosis from that disc, but it's so severe that all the control things that you right aren't better, and you're at a point where you from spine surgery, decompress. Very in the States, there's a sort of like a varying amount of how much peripheral surgery you do, neurosurgery you do, because plastic surgery, sometimes orthopedic surgery, but we'll do carpal tunnel surgeries, oddly very quick. Release nerves that are compressed at the elbow.
Right, decompress the nerves. Yeah. Wow.
So when you get done with Yale, maybe we can speak with the things happening where they can change, have them come here, spend like 6 months, when they commitments, save some people, and
right, the right people, the right parties. But I don't know how, but
it can happen. When the time comes, once we're still find a way.
Yeah, I mean, they're with all them. I remember reading, and I know you read it too. A gifted. He had to go to Australia to do, a lot of it, surgery, neurological surgeries, because especially like things like that. As a resident, they don't usually let you, actually do them. Have you ever done any?
Depends. The point of the training program is for you to ultimately be able to do them.
Yeah.
I have, not independently,
Wow.
but
Yeah.
you'll have, you're working with, it's a small residency. We're 13,
Mhm.
2 people a year. And in terms of the folks who are actually in that, it's a lot, a much smaller number.
Mhm.
So, gradually, the
You
training,
migrate.
things when they feel like you're at the point where
Mhm.
they'll let you do, large parts of the case. And then the point where president the 7th year, of course, you're still a resident, so
Right.
there's obviously going to be a lot of involvement from the attending, but sometimes where there doesn't need to be any physical involvement. I've been in those cases. Any physical involvement from the attending, you just need the supervision.
Hmm.
You do the entire case.
Wow. And I tell you, your neuroanatomy, I did not like. I didn't like the tracks.
Yeah,
You feel
yeah. But I was
like
a neuroscience major in
okay.
college.
I don't like.
So I
Oh,
had
see,
to learn it, but not my cup of tea.
I didn't like the tracks. To do surgery in those areas, that is yeah, you're very, very much needed. And very, very.
Yeah. One thing I learned, I mean, a lot of the surgeries, some of the surgery can be crude, of course, very tough.
Yeah.
But one that I learned throughout, it's not only about being able to do the surgery. Really very important that you know when to do surgery, who to do surgery on. You don't do unnecessary procedures. Right?
Well, so
So that's it.
you have to be you have to really know neurology very well.
You do.
Right?
You have to have a really good neurologic foundation.
Yeah.
But then also, even within surgery,
Hmm.
I think it's a very far realized that the field is very big on making decisions. And sometimes those decisions can be pretty critical for
Crucial.
so
Yeah.
Time is the time that you have to do certain things. Sometimes you have things.
sometimes you do.
Yeah.
And sometimes it's also very hard at times to explain, especially in a serial. And then you have like young patients,
Hmm.
very in a very precarious situation, and you have to explain this to the family and consent for like an emergency procedure and whatnot. And
That's
sometimes
tough.
people not really
Yeah.
involved. People are in shock and whatnot. So it's
So all they want to do is make them live. That's just make him live.
very big on being efficient, but also building rapport very, very big. So that's another part of the field. And
I can imagine that there are times when you see what is coming and you try very hard to stop it happen. I think you had sent me some emotions in a way because the person couldn't.
that thing we develop sometimes very dark humor. But you see, I've seen a lot delivered in you, and then sometimes it's very, a lot of emotion, not just from family, members, but just everyone in the care team. You sort of know the trajectory of diseases, or it can be very sad.
Yeah.
And
But we sad states from we to put avoid those times, but still we can't save everyone. It's not going to do what it takes sometimes.
very sad, but they can also be very rewarding.
Yeah.
So
I mean, you see some young people, a group of friends walk and out of a friend. Foaming out of his mouth. Really outside. I mean, no, nothing we can do. Anything like that, but and I think the attendant was there and he said this needs somebody in neurology because I don't know what to do with this guy. And the part they suspect he was on some sort of, but have you like organic and anything like that in scenario, but
I've seen it. I won't type. Be the prime on it.
yeah,
Many,
right,
and there's be some sort of there's suspicion or surgical a scan or have you okay. Absolutely.
No. I'll head Dr.
I would be, I chose. I wouldn't want to be in a.
Same reason why I chose dermatology, exact opposite.
That's what I was going to come to that point. I asked you that. But I bet though I could see this when patients, especially a little older patients, come to the hospital, your age, and they ask to see the doctor, or so then you go up, sometimes.
Yeah.
It still happens. The attending that saw a patient, introduced myself to Haynes, and then message saying, "Miss Haynes, I am your doctor. I prescribe your medicines."
Okay, I have to knock them 4 minutes. So you look down, there's only the message.
Just started warm up.
I'm telling you, up, and give us some more time, give us some more time, Dale.
This is very, very urgent for
Baby face, but they're very.
very
A lot, actually. Well, I'm 15. It gets a big chuckle out of everybody. I did at least 4 times a day. Oh,
Then what do you think, sir? Yeah. Yes. So it's. I'm very. I just all the best, my support and everything that they do for that, and you do it, and you knows that there's never been this guy at 4 years old, he said he's going to be a neurosurgeon. At 4 years old, he stayed on course.
Oh, yeah, really?
He put down the phone for a little bit, but he needs to pick
Oh,
it
you
up.
you blow the saxophone?
He's a very good saxophone. Yeah.
Waiting to hear it.
That's a challenge. That's
I want to.
that's a you see. Plays a very good saxophone, and we actually played together at one time.
Really?
Myself, him, and Joel. Yeah, we played together one time.
That.
Yeah, my program. Yeah, we did.
Oh, really?
Yeah.
Oh, so you can really play. I mean,
Yeah,
I was trying to learn how to do that. I remember when you were playing the trumpet, I was playing the saxophone, and Haynes was playing the bass.
yeah.
Yeah, we did that. I don't know.
A lot of people don't
few
know
times.
I can play those.
Yeah.
Yeah. Saxophone. Play saxophone. I mean, I play trumpet.
So that trumpet, right?
To Jeremy.
Oh.
But I probably will take it back.
You're not using it.
I play the drums. Drums fairly well. I play drums in many places. I played all in Australia. I played drums in Singapore and Australia. Yeah. Music has a place in medicine, I think. I think music belongs in medicine, especially in this space, you know. Can you imagine anesthesia, the saxophone? They'll hear that, and you never know what they'll do inside.
Yeah.
It might just bring the healing about. No,
Therapy is a real thing.
Yeah.
We have that
Real.
at the hospital.
People actually do that during certain.
I am of the opinion that everything that you do in life is linked to what you're going to do. And learn you were growing up. Surgery. I believe that. Remember what I say, that music will make a difference in a lot of patients' lives. And Christ's life too.
Yes.
Anyway, we probably out of time. I asked him for some time. I didn't see him respond with any more time. Words that you have, Sterling?
I would just say, like we were saying earlier, important things, these really bad things that you see that Dr. Joseph was talking about from happening. So go see your doctors.
That's a big one. Second that, and then otherwise just is it's not nice. Might be a bit, where your starting point might be not as advantageous as someone else's, but you can still get there.
Your brother was also here. You flew back today. He's going to be a pilot. You never know. You might be a flying doctor. He might be the one to fly you to some place to get some surgery that is crucial to somebody's life.
Yeah.
You just never know. But when that happens, just remember that I'm here. I can go. I can even carry instruments.
Yeah.
But Dr. Richard, anything you want to say?
Yeah, I mean, I know we talked about a lot of things, and it's the resources are there. I mean, they're right next to you there. When you have some cases, neurological situation and dermatology, a lot of cases. I mean, it's a funny thing. They may be sick or something, but something can pop up on your skin that. I mean, I go to the doctor, but your face or where they run quickly. I tell you, I'm itching all over. my back and my chest, and I had this thing came, you know, there, so I had to get pictures and things like that. And it's interesting how dermatology in medicine, a lot of things are, happening inside, and then it has a reflection of what's going on in the outside, right?
And we have to have a good understanding of all of it.
Yeah.
Do the best for our patients. So
We didn't talk about skin cancer, but that's part of what Dr. Haynes do. Skin cancer.
See a lot of cases.
surgery too.
Really?
Mhm.
Yeah. And you do a lot of elective surgery too, like any plastic surgery or anything? Or?
I have made deals.
Oh, you do Botox too?
Yeah, PRP mostly. I don't do it. I don't do the plastic stuff. That's like out of my area. That's just too much. But taking things out.
So like and skin tags and all that.
Yeah.
That's pretty nice.
And then
Surgery too.
it's crazy as possible. 100%. Ours are do it in clinic.
Yeah.
Very much 20 minutes. So
Listen, I couldn't deal with the smell. I know. Now that's another time for that one. On through skin, unique smell.
yeah,
Yeah.
People,
And then you have to be tolerant.
some people get hungry afterwards. It's reactions to it.
Probably go eat a Big Mac after they're done.
Yeah, people get hungry after we do our surgeries with scarring. I'm like, okay.
After that, to see all that flesh, you go eat another piece of flesh and burger or something. I just wonder that if you have any questions about neurology or your nutrition or anything, you can always call us at the clinic. The number is screen there in the studio, 231-6477. We somehow are going to try and put some link addressed, from long distance. You never know.
Yeah.
Because
consultations. Yeah.
Yeah, they both are not here, but we are here. And we have a website. You could visit our website. I was just reminded that we have the website, and you could visit us. Put Dr. Joseph there, or you can go www.health and wellness. It's on the screen there. Just take it, and so we'd be glad to try to. Maybe you could maybe what concerns you have, and we go to the website, pick it up, and then we could forward it to you, Junior or Dr. Stalin or Dr. Richard or myself, and we could respond to you somehow if it's if it can be. If you need any intervention, then I could probably give you some good program because it's live at home in home. But the time was too short for 4 doctors. It was too short, so come back at some point very soon because you have unfinished, and we don't believe in unfinished business. We try to. I'm just letting you know that you have unfinished business, so you have to come back. We take you to the health authority here so that you could be introduced, and maybe they'll maybe you can't refuse. No.
I like all.
I don't know. I don't think we.
I don't think you have much of any.
I feel like I saw 3.
But 3?
Yeah, there's 3 off of Google.
And the neurosurgeon.
Yeah.
So there's a lot of room for you, Dr. Joe, and with 3, nothing here compared to the problems that we see. So, but there's room for both of you. Just go do your thing, and Let's keep Guyana in mind. We're a fast developing country, and we take glad to have you as part of our.
You never know.
Just never know. All right, Dr. Richard.
Yeah,
I
very
think we have
good.
to say something on behalf of Dr. Joe, Dr. Richard. We want to thank you for gracing us with your presence and for yes, and Oliver. Oliver is very instrumental in doing work. He's a medical expert. We have to thank Oliver too for setting everything up so we can have this program. Pass on. For watching. Again, we appreciate your input and we appreciate your presence.
Thank you.
And the doors are open. The doors are always open. And I do like the guys on what's the program is sing? The guys to pick. Oh, the other one.
Oh, The Voice?
Snoop the Voice. On behalf of the Voice is you gonna ask you at some point who. But we're glad to have you here. The doors are always open, and thank you for coming to Guyana
Thank you.
and blessing us with your presence. And I'm quite sure that Richard is much.
Oh,
And we want to say on behalf of our clinic here and all of those who were part of what we had
good night.